But basically, very quickly after her initial treatment, she developed these inflammatory lesions over the injection sites, and they appeared to be infected.
And I'm going to show the camera what we're talking about.
Yeah.
Why don't you tell us about this poor lady? First of all, how old was she, and how long has she been doing treatments, and just a bit of a general background before we get into the sort of the disaster, I guess.
Sorry, you've got me chuckling now because I'm realizing that I never ask a lady her age, but I actually can't remember her age. It might be on the sort of summary that I sent through to you, but she's a late 40s year old lady who's a professional makeup artist. So unfortunately, as a professional makeup artist, it's very important how she looks. And so when I met her, she wasn't working, she wasn't able to work, and her appearance was causing her very significant anxiety. It's notable that you didn't include the word rare in this particular introduction to the case, because I seem to be seeing more and more people that are quite similar. And in fact, Victoria is one of 9 ladies who I interviewed remotely during the pandemic, who were originally referred to me via Safe Face, which is an organization in the UK that sort of helps and supports and raises awareness of complications in the aesthetic arena. So I initially spoke to Victoria over a video link, and she sent me some photos through. And the story was basically that she'd been injected by a non-professional or non-health trained, as we sometimes say in the UK, person with botulinum toxin, which she was told was Azalure.
Right,
and
which is Dysport in alien language. Mm-hmm.
Yes. And it's one of 3 licensed toxins in the UK. We don't believe it was Azalure or Dysport that she was injected with, and that fits with the other people that I've interviewed who have similar and varying stories as to what happened to them. But basically, very quickly after her initial treatment, she developed these inflammatory lesions over the injection sites, and they appeared to be infected. And so she did what most people do. She contacted her practitioner, as we call in the UK, and they were quite surprised, even though the person who did it was getting a lot of this.
Can I wheel you back, Cormac? I've just got a question.
Yes, of course.
So
yes,
this lady, had she had treatments prior? It wasn't like a new non-medical practitioner that she just randomly met.
She had previous treatment, yes, without problem.
And the same practitioner had treated her previously without any dramas?
Yes.
And, I don't know if you ever got into this, because obviously you just managed her case. It's not your job to sort of do the Sherlock Holmes sort of, hunting of the story. But did you ever communicate with the injector to, just ask to collaborate the history and maybe give you the batch number of this toxin, those kind of routine questions?
No, I never did. And it's a very good question, and something that, I do wonder if, in hindsight, I should have done. I think the problem was that it was presented to me as a rather murky story. And I think Victoria was possibly the last of the 9 that I had interviewed.
9?
And she was, right. Yeah. And she was kind of wheeled out as, look, that we're really worried about this one. She's come forward and she seems to be the worst. And of the 9, there did seem to be, there was a couple that had a little bit of a residual issue, but a lot of them said, yeah, it was a nightmare for a few months and I needed lots of antibiotics, and eventually it settled down. But with Victoria, it just wasn't showing any sign of doing that.
You know what I'm going to do? I'm going to pull up the photo and I'm going to show the camera what we're talking about.
Yeah.
So this poor lady, from your description, had 2 sort of lumps in the center of her forehead, and then one each on each sort of lower crow's feet region.
They look like boils or something.
Yeah. What did they feel like? And how did they just come up overnight, or what was the story to these things?
So yeah, they within days, and since Victoria, I've now seen 2 other people who've had similar, if not worse, than that, because this is the problem when you see someone like that, they say, "Oh, I know who might be able to help you." But yeah, they came up inflamed, and these things typically will fluctuate, so they'll get bad. Sometimes they'll be fluctuant, sometimes they'll be indurated or hard, and then somebody will give them an antibiotic, whether it's in this situation the treating practitioner, not professional, organized their prescriber to get an antibiotic. But it's never a one-off thing. It's patients like this, go to A&E and get antibiotics. They go to their GP and get antibiotics. I've had a lady, not to digress, a lady recently who was actually on antibiotics and steroids rolling for about 9 months.
Oh my goodness.
And the problem is that we don't have in the UK an infrastructure that will manage these people. And of course, you turn up to A&E or your GP and they say, well, we don't do aesthetics. And frankly, this is a private thing. So please go away and see somebody that wants to or is responsible to deal with this. But of course, in the private arena, nobody takes responsibility. So patients like this end up just, adrift and desperate. But yeah, sorry.
Oh, sorry, I was going to ask. There's a great point. I remember watching something on YouTube, and it was some non-medical injectors, talking about what they do, and I just watched it out of interest to see, how they run their business and stuff. And I think they basically inferred that the criticism that they get that they're non-medical doesn't apply, because if they run into a problem, they'll send them to a doctor, and that was their sort of get out of jail card. And I just thought, how ridiculous is that? You're treating people with impunity, and yet if you run into any sort of problem, you go, well, not my problem, I'm going to send them to A&E. Yeah. And is that your experience? Is that what CMEC is seeing?
Yeah, and it's a very complex issue, because historically in the UK, no one has been measuring the presentation of patients like this in A&E. So when you, and both Lee Walker and myself approached our local tertiary centres about 5 years ago, and under a Freedom of Information Act, we said, look, we want to know how many injectable complications you've had pitch up in the past year. And they both came back independently and said 0, because it's a problem that they don't measure. So if anyone says, look, is this an emerging problem? We're concerned that the NHS is getting overburdened with complications from private treatments. Is this a thing? They go, no, we don't have anyone showing up whatsoever. And of course, it's because they're just being coded as something else.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.